Hi, welcome to the Body Shop Physical Therapy. Do you ever get jaw pain or have temporomandibular joint dysfunction? I'm going to go over two muscles that can be a culprit to temporomandibular joint dysfunction. Hi, I'm Dr. Catherine Price and I'm a physical therapist. In this video, you're going to learn trigger point release of the medial and lateral pterygoids. Those are the two muscles that can be involved in temporomandibular joint dysfunction and jaw pain. So if you grind your teeth, have poor posture, or you get that clicking imbalance in those muscles, you can possibly have some dysfunction in these muscles, and addressing the trigger points can help alleviate some of the temporomandibular joint dysfunction. One muscle that's commonly overlooked to having arthritis in your jaw can be the lateral pterygoid. Now the pterygoids are going to attach to the sphenoid bone and the greater wing of the sphenoid. So that is a bone that's in the cranium. Its wings are right in that temporal region. Now if you go to find your jaw, open and close your mouth, and right where it articulates, you're going to be at your temporomandibular joint. The lateral pterygoid is going to attach to the capsule there, and it's going to help protrude your jaw. So if I gently open my mouth to relax the masseter, so the masseter is that muscle that goes from right underneath the cheekbone or right at the cheekbone down into the jaw. So that muscle is going to overlie and be responsible for chewing. The lateral pterygoid is going to open the mouth. And so I'm going to protrude my jaw and gently open my mouth to relax the masseter and then be able to palpate and feel the lateral pterygoid contract. So if I gently open my mouth and protrude my jaw, I can then feel the muscle contract, and that is going to be my lateral pterygoid. I'm then going to investigate and look for any tenderness or areas of tension. And I have more on my left side. So for 3 years, I had pain in my teeth on the left side, and I left that unchecked. So I spent 3 years chewing on the right side. So therefore, I grind and chewed on the right side where I shortened the medial pterygoid and overcontracted that, while on the other hand, I had dental work and did not work this side. So I overstretched and I ended up having more stress in the left side with work, as well as not having the closing. So I closed too much on my right side and I had opening and overstretching on the left, and that had me develop trigger points in this lateral pterygoid on my left side. So I do have some clicking and grinding when I open the left side of my mouth. So I want to balance that. And to do that, I will go in and work on that lateral pterygoid. I spend about 2 minutes to work on the fascia, which is the connective tissue around the muscle, as well as holding areas of tenderness for about 15 to 20 seconds in order to release those areas. So I'm going to release the trigger points over the lateral pterygoid and hold after working on that for 2 minutes. I'm then going to go and investigate the medial pterygoid. So as I just said, I chewed for 3 years on one side and had pain, so was not able to chew on one side for 3 years. So I have a lot of tension on my medial pterygoid on my right side. Now to find the medial pterygoid, again, the pterygoids are going to attach to that sphenoid, but the medial pterygoid, you can work on the inner mouth to find it, but you can also go right underneath the ramus, that corner of your jaw, and you can press in, you can slightly push up and into the jaw, so to speak, and you will feel when you bite down, you'll feel the muscle contract, and that is going to be the medial pterygoid. Now my right side is one that is overcontracted, so I'll find areas of tension and tenderness, and I will hold that and again work on the medial pterygoid for 2 minutes. To find that going, you can also go inside the mouth for the pterygoid. So you can use your index finger, go right down, You're going to go right down towards the last molar, and you're going to go on the outside of your gum, go past the last molar. If you press inward, you're going to run into that medial pterygoid. And so I press in. And you can bite down to feel it contract. If I press out, I'm going to run into that masseter muscle. So I can put and apply pressure and hold that and stretch that for up to a minute. You can even work on that area for, again, 2 minutes for releasing the fascia as well as the muscle tension. After working on the medial and lateral pterygoids, I'm then going to stretch the muscle by opening my mouth, and you can also close. So your medial pterygoid is going to close your mouth, so it's going to tense when you grind, and the lateral pterygoid is going to assist in opening your mouth. So I'm going to stretch the medial pterygoid by opening my mouth, and I like to assist that anterior glide by gently applying just gentle pressure to assist the jaw to open. Holding that stretch from anywhere from 30 seconds to a minute. And then to isometrically contract the lateral pterygoid, I will gently isometrically contract with opening my mouth against my fist. So I'm not going to be moving my jaw, but I'm just going to gently open. Hold for 10 counts, and that is going to retrain the lateral pterygoid to help with the muscle tendon relationship. And then after doing that, I can just open and close my mouth. And that is going to stretch the lateral medial pterygoid. Those are going to do opposite contractions. And when you balance both sides, so you may find that the medial is tight on one side or has trigger points on one side, and the lateral pterygoid has trigger points on the other side. Balancing those muscles can help with the movement in that joint to help prevent and or reverse some breakdown that occurs in the temporomandibular joint, and allow that joint to move more smoothly in order to assist in chewing and alleviating some of that pain. And once you do balance those muscles, that grinding, clicking noise and sensation, that may start to subside. So if you are having temporomandibular joint dysfunction, those two muscles can be a culprit, and it can be helpful to address those. So I hope this is of help, and have a blessed day.